What happens during suture removal after surgery? Have you ever wondered what actually takes place when it's time to remove your sutures after surgery? This process is an important step in your recovery journey. Let's break it down so you know what to expect. During suture removal, a healthcare professional will first identify the stitches on your healed wound. They will use sterile tools like forceps or tweezers to gently lift the knot of each stitch. This part is usually quick and should not cause much discomfort. You might feel a slight tugging sensation, but it is generally painless. Most of the time, there is no need for anesthetic during this procedure. Once the knots are lifted, the healthcare provider will use sterilized scissors to cut the thread close to the knot. Then, they will slowly pull the suture out through the skin. After all the sutures are removed, the area will be cleaned using a moist gauze or antiseptic. This helps to remove any debris and reduces the risk of infection. In some cases, thin adhesive strips, known as steri-strips, may be placed over the wound. These strips support healing and help prevent the wound from reopening. Typically, these strips will fall off on their own within about 10 days. The timing for suture removal can vary based on the type and location of the surgery. Generally, it occurs between 8 to 14 days after the operation. If you have resorbable sutures, which dissolve on their own, you may not need to have them removed. However, sometimes remnants are taken out to ensure proper healing. After the sutures are gone, it is important to continue gentle wound care. Keep the area clean by washing it with soap and water. Pat it dry gently and protect it with a bandage if the wound is in a spot that might get dirty or injured. Be vigilant for any signs of infection, such as redness, swelling, pus, or if the wound starts to open. Avoid activities that might stretch or bump the healing skin. If any bleeding occurs during removal, the process will be paused and appropriate care will be applied. Always remember that suture removal should be performed by a medical professional to avoid complications. This straightforward procedure allows your wound to continue healing naturally, and with proper care, you will be on your way to recovery.